Hello, my name is Alondra Dominguez Ramirez, and this is my Ignite presentation. I have chosen to speak about the incarcerated youth today. First, we need to understand who are the incarcerated youth. The incarcerated youth are individuals under the age of 18 who have been sentenced to juvenile detention centers or adult correctional facilities. These youth are oftentimes from low-income families in communities of colors. Many have experienced trauma, abuse, neglect, and have not received the support and resources that they need in order to thrive, which is why they have ended up in jail or some sort of correctional facility. These are some pictures that I found about the incarcerated youth. Today I will be talking about the social problem with incarcerated youth, and that is mental illness. Incarcerated youth often experience a decline in mental health due to the stress and trauma of being incarcerated. Youth who are incarcerated are more likely to experience depression, anxiety, and post-traumatic stress, and they are more likely to experience suicidal thoughts and engage in self-harm. Now we are going to be talking about the unmet needs. The incarcerated youth have unmet needs, and those unmet needs are the lack of understanding of mental health. I found this quote from an article that says, they report that detained adolescents commonly experience poor health across a range of physical and mental health domains, including mental disorders, self-harm and suicidal behavior, substance use disorders, neurodevelopmental disabilities, blood-borne viruses, and sexually transmitted infections, and sexual reproductive health. Why is the incarcerated youth's mental health important? Now, there are many reasons why mental health is important overall to all the people, but it's mainly important to youths who are incarcerated because they it is an understanding that at the end of the day, the youth are still children and their brains are still being developed one way or another. We want to help our youth stay away from substances, which usually go hand in hand with mental health issues. Many times, a lot of these youth do not know how to cope with their mental health and are not understanding what is going on. So they will cope by using substances such as illegal drugs or alcohol. Now, the United States has one of the highest rates of youth incarceration in the world. This is one of the graphs that I found in one of the articles that I read, and it talks about the different incarcerated youth, and it distinguishes them by age. I was shocked that children as young as the age of 12 are already in these juvenile facilities, all the way up to the age of 20. And as we can see, those numbers are very high. Now, I want to understand and I want to know how we can improve the mental health in jail and prison for the incarcerated youth. As social workers, there are many ways that we can help improve the mental health in jails and prisons for the incarcerated youth. One, by having mental health assessments that identify which incarcerated youth might be prone to having a mental health problem based on their history. Um, Another way is that social workers need to help keep people who struggle with mental health out of correctional facilities. A big change that needs to be made is that the number of people in isolation needs to be decreased. One of the researchers states that he encourages facilities to provide inmates information at the time of booking about what they might experience psychologically once they are incarcerated and the steps to take if they are having symptoms of anxiety, depression, and other types of mental illness. I believe that this is something that they should be prepared for, as this is a change that they have not experienced before unless they have gone into jail or prison or juvenile detention facilities before. And maybe by informing them of the possibilities of the mental illness that they might experience, they might be able to tell the officers, hey, by the way, I already struggle with this, and maybe this is an intervention that social workers, police officers, anybody in the detention facilities can work together to keep an eye on certain people that are already struggling with mental illness. I like this quote from the restorative justice principles that says justice requires that we work to restore those who have been injured. And in this case, those who have been injured are the incarcerated youth who are struggling with mental illness. A change in policy. Now, it's important to change policy. That is the whole reason why social workers exist in the first place. Changing policy for incarcerated youth requires advocacy, and that is what as social workers we are taught to do. We are taught to advocate for our members, and in this case, we would be advocating for the incarcerated youth. We are also taught to work with lawmakers to create new policies, to change the existing policies in order to have better care for the youth. It is important to raise awareness about the issue and get people involved in advocating for change. Not only can social workers advocate for change, but also the family members, the friends, or anybody who is close to the incarcerated youth can also advocate for this change. Now, one of the researchers states, sharply limiting the justice system's use of incarceration by using fiscal incentives that encourage courts and corrections agencies to keep youth at home, and by prohibiting incarceration as a response to lower level offenses. Many times, a lot of the youth get in trouble once and they are taken straight into the juvenile detention centers instead of being educated and maybe trying to work out the problems as to what had really happened. The change initiative. In order to change what is happening right now, we need to prioritize mental health. We also need to raise awareness of mental health We need to increase social workers and mental health professionals in schools and identify problems early. Many of the youth start having problems at a very young age, and by having people to be aware of what's happening at an earlier age, maybe we can change the outcome of the future of these youth and they would not end up in jail. Now, the social worker's ethical responsibility to the broader society is to treat each and every person in a caring and respectful manner. It's to have cultural competency, respect, and have social and political change action to help the incarcerated youth. The impact of social workers. Social workers can have a significant impact on the lives of incarcerated youth by providing mental health services, counseling, and support. Social workers can help youth develop coping skills, build healthy relationships, and access resources that can help them succeed. Social workers can also advocate for policies that prioritize the well being of being incarcerated and work to create programs that provide education, job training, and other resources that can help youth transition back into their communities. Now, we need to understand what are the strengths, weaknesses, opportunities, and threats that might influence the adoption of policy change. The strengths are that we would increase awareness and understanding of the importance of mental health for incarcerated youth. We would have a growing support for policies that prioritize the well being of incarcerated youth. And we would also have the availability to provide interventions that can improve the outcomes for incarcerated youth. Some of the weaknesses are that we would have limited funding for mental health services and programs for incarcerated youth. We would also have lack of political will to prioritize the well-being of incarcerated youth, and there comes a lot of stigma and negative attitude towards the incarcerated youth from society. Some of these opportunities include increased collaboration between social workers, policymakers, and advocates. And we would also have a growing interest in restorative justice and other alternative approaches to incarceration. And we would also have advances in technology and telehealth that can improve access to mental health services. This means that although these youth are incarcerated, they can still see psychiatrists through telehealth, through Zoom, in order to receive the help that they need. Some are that we will have resistance from policymakers who are not willing to make the change. We will have limited public awareness and understanding of the importance of mental health, and there is a lack of data and research on the effectiveness of mental health services for the incarcerated youth. What steps should be taken to achieve the change of providing better mental health for the incarcerated youth? Now, there are several steps that can be taken to improve services for the incarcerated youth, and here are a few that I thought about. Now, one of the biggest one is increased funding for mental health services. We can also we also have to provide training and resources for staff, administrators, and anybody who works with the incarcerated youth to better understand the needs of mental health services. We would also have to implement interventions that have been shown to provide outcomes for the incarcerated youth. We would have to make a change to the policies that are already in place. We would have to develop programs that provide education, develop programs that provide job training, develop programs that help youth get back into society, increase public awareness, understand the importance of mental health. Now, by taking these steps, we can improve outcomes for incarcerated youth and ensure that they receive the support and resources that they need in order to succeed. Now, that is the end of my presentation. These are the references that I used. Thank you so much. Once again, my name is Alondra Dominguez Ramirez.